Hi, this is Dr. Jason Dulac coming to you from my office in Springfield, Virginia. Today I wanted to answer some common questions about dental extractions. There's a lot we can do nowadays to save a tooth, but sometimes the decay has gone deep under the bone, or there's not enough tooth left to restore the tooth or put a crown on it. We can't do a root canal on the crown. The tooth is split. Something happens that's beyond what we can save. In those cases, nowadays, thankfully, we have dental implants. So we can take the tooth out, let it heal, and put an implant in. Implant's a great replacement option for a missing tooth. And I have a lot of patients who are concerned about extractions. You're going to be totally numb. If you're worried about it or you want something to take the edge off, we do have laughing gas in my office. Most of my patients after the procedure do not need narcotics. 9 out of 10 of my patients take over-the-counter pain medication after the procedure. We always have something stronger available. I've got a whole separate video on post-op instructions if you want to check that out, but there should be a mild post-op discomfort. Usually the breakage of the tooth or whatever brought you in or whatever reason it needs to be extracted is much more painful than the post-operative recovery. So an extraction is recommended when we can't save the tooth or the decay is too deep. A root canal would be another option if the decay gets into the nerve and you can still save it, but sometimes you can't. I've got another video on root canals. Check that out if you want to learn more about root canals, but sometimes it's beyond what we can save with a root canal, or sometimes people would rather get the tooth out than get a root canal. And like I said, with implants nowadays, there are advantages and disadvantages to both. If you have more questions about that, just let us know and we'll go over the advantages and disadvantages of both. Implant's a bit more of a process. Take the tooth out, let the bone heal, put the implant in, let the bone heal before you get the crown. So it's really the time. That's the bone healing time that you have to wait on for an implant. But the healing time for an extraction, you take the tooth out, gum will scab over within 3 to 5 days. Within 3 to 4 weeks, the gum will be covered. Then you don't have to worry about anything. The bone will slowly mature under there for the next 3 to 6 months. After 6 months, the bone's totally healed. Sometimes you can do an implant as soon as 2 months after the procedure. Sometimes you have to wait the full 6, depends on the case. But we're not aware of the bone healing. It's just the gum healing that you'll be aware of. And like I said, after the first week, you're going to be in good shape. The pain after the procedure is going to peak either that day or within the first couple of days. Like I said, most of my patients are fine with over-the-counter pain meds. Mild post-operative discomfort's normal. If there's any acute pain, that could be side of a post-op infection or a dry socket, which is like a nerve pain after a tooth's taken out. Usually only in smokers, but no, I haven't seen it in a non-smoker in a while, but it happens. If you're worried you might have that, give us a call at the office. There's a medicated paste I can put down in the hole to help seal the nerve. Wisdom teeth, if you're going to take them out before the age of 25. Up to age 25, you'll get complete bone healing. If they're deep or impacted, I can refer you to an oral surgeon. They'll put you to sleep, get it out. But about that 18 to 25 range, we'll usually start looking at the x-ray, see if the tooth is going to get stuck in there, is impacted, see what would be involved to take it out, and go over the risks and benefits of taking it out or leaving it in. If you wanted, a universal recommendation, I'd say, get them out. But each person's different. Our downsides to keep them in, but sometimes I'll have somebody with a big mouth, they'll come in straight. If they want to keep them, maintain them, that's fine too. So it just depends on the person. So if you have any questions about, taking the wisdom tooth out is right or not, give us a call. We'll get the x-ray that goes around the head. You can have a 3D x-ray machine in the office so we can see how close that impacted wisdom tooth is to the nerve or the sinus, give you an idea of if it's a high-risk procedure. We have that 3D x-ray available. I do like to do a lot of surgery. I do a lot of surgery in my office, but if you want to be put to sleep, we work with a lot of great oral surgeons too. So if you want to be sedated for the procedure, I recommend an oral surgeon. Sedation's around $1,000 usually. We have laughing gas or nitrous oxide in the office. So you want something to take the edge off that's safe to drive afterwards, I'd say do it with me. If you want to be out and get a driver, I'll give you a referral to an oral surgeon and they can sedate you and take the tooth out. There's not a right or wrong decision. I work with a lot of great surgeons. It's whatever is going to make you feel the most comfortable. During the procedure, you'll be totally numb. You should not feel any pain during the procedure at all. The deep pressure nerves never get totally numb. So there might be an awareness of some pressure or pushing. If that's concerning to you, I'd say the oral surgeon get sedated, but you're not going to have any pain during the procedure. If you ever feel anything in my office, whether it's an extraction or anything else, just raise your hand. I'll stop right away. And we'll get you some more numbing. I'm never going to work on you if you're not numb. Different anesthesia options available. The local will always give the numbing. There's the laughing gas or Valium in my office. There's IV sedation with an oral surgeon, or for some people, general anesthesia. It's this next level up from IV sedation. So sedation, you won't remember it. You'll have amnesia. You'll feel like you were asleep, but you're still awake. You're still responding to commands. You're still breathing on your own. For some patients, they're not a candidate for sedation in an outpatient setting. Some individuals, especially kids, you can get an excitatory effect for the sedation and they have to be put under general anesthesia. So there are advantages and disadvantages to each. The oral surgeon I refer to does both. So if you are looking to be sedated or put to sleep, that's always an option. I can can bring an anesthesiologist into the office, but the minimum for that is usually around $3,000. So for most patients, it's cheaper to see an oral surgeon. So I usually refer to an oral surgeon as those cases. After the extraction, just need some time to heal. We'll send you home with some gauze and bite on gauze. If it's bleeding, you can do ice pack on the outside of the face, tea bag. But you can pretty much eat to comfort, drink to comfort, brush and floss to comfort, physical activity to comfort. There's not a lot you can do that's going to hurt the healing other than sucking through a straw or vigorous swishing for the first couple days, or smoking. It's really just smokers that have to be careful. I definitely recommend a patch. The gum is better than smoking, but it's still nicotine in the mouth. Unless you're smoking, you're really not going to have to worry too much about the post-op instructions. How much time off do you need after an extraction? Depends on the person. I have people with take a tooth that go back to work. Usually it's the bottom wisdom teeth that involve the cutting, and people are known to get the chipmunk cheeks after. But top wisdom tooth comes out, probably go back to work the next day. You might want to avoid heavy physical activity for a couple days, but I have patients that like to take a day or two off, like do it on a Thursday, take Friday off, by Monday they're good to go. I have other patients, I have patients who are construction workers, never take do that, they go back to work. So it's really more of a comfort-based thing. There's not absolute do's and don'ts after the extraction. It's usually related to post-operative discomfort more than anything else. If you have any questions about extractions, if you need an extraction, if it's right for you, if we can save the tooth, if you want to take it out, if you want an implant, post-op instructions, anything like that, I've got whole other videos on that. I hope this answers some of your questions. Give us a call at the office, 703-451-4500. Our website is dulacdds.com. Thanks so much, and I look forward to seeing you in the office soon.